I think some of it, so some of the discrepancy in practice variability and diagnostic variability can definitely be attributed to kind of a lack of awareness of the most recent consensus statement, for example. So that statement that a genetic etiology or other cause should not exclude a diagnosis of cerebral palsy, that was made by international consensus. It's unclear how widely read that statement was amongst these practitioners, or at the very least, it's unclear what the uptake was in terms of that statement. The original consensus definition, or the most recent consensus definition from 2007, does include the line that cerebral palsy is not an etiological diagnosis, that it's really a phenotypic or a clinical diagnosis. And interestingly, that citation for that definition and key points from that definition, we wanted to make sure everybody had the same knowledge base. So we included that in the survey before they actually got to the hypothetical scenarios. Given that people were purposefully made aware of the 2007 consensus definition before they answered the questions, suggests to me that it might be more likely that the definition is interpreted differently by different practitioners as opposed to it being a pure educational issue. Cerebral palsy has, as a disorder, even though it's remarkably common and it's the most common cause of motor disability in childhood, it's fallen kind of in the middle of several different specialties, and neurologists have not, as of late, taken real ownership over a lot of these patients. So there's a AAN section, the Adults with Intellectual and Developmental Disabilities, that I'm vice chair of. And we're really starting to advocate for cerebral palsy as a topic, as a disease process, to become more of a focus in the AAN and for neurologists in general. And I think you're right. I think education amongst neurologists about this group of patients, mainly even to say that we should have a prominent role in caring for this group of patients and in diagnosing this group of patients, is important.